Welcome to MACJ Mic'd Up, your one-stop podcast for health, finance and everything under the one sun. Brought to you by Somaya Vidyavaya University. Medical science is such a vast subject containing learning pedagogy skills, challenges and new touch-up of technology. All these aspects are better to know from experience. And when we talk about experience, our guest for today is expert with young energy in him. I am your host Shantanu, and today we are joined by Dr. Rohit Mody, DM Cardiologist, to discuss on medical science, past, present and future. So let's begin. So, hello Rohit sir, welcome to MACJ Mic'd Up,
Thank you.
your one-time podcast for health, finance, everything under the one sun. So sir, first of all, my first question is to you. How was your journey from a student to an MD, as you're seen approximately very vast experience in this health field?
Yeah, this journey has been always having both ups and downs. I started my journey in 1966 at MPSA Medical College, Jamnagar, where I joined MBBS course.
Okay.
That was 4.5 years course, 1 year intensive. Then I joined MD Medicine, which was 3 years course. This everything I completed in, say, up to 1975. So it was 9 years journey. Then I came to Bombay in 1975 and I joined DM Cardiology course, which was the course of 2 years, but those days students used to fail and I had never failed in my life. So I thought I will have much experience, then I will appear in exam.
Okay.
So after 6 years of experience in cardiology, at Nair Hospital 2 years, 4 years at Sion, then in 1981 I appeared in exam and passed DM Cardiology. From DM Cardiology at Sion, then I started practice in Ghatkopar, and now it is 2025. So I had a medical journey of at least 59 years, a cardiology journey of 50 years, and practicing journey in cardiology is about 44 years. It's an interesting journey, we learn a lot, but as you know that when river passes through various routes and reaches the ocean, it has to go through many ups and hills and downs. Similarly, my journey was also very good. I enjoyed the journey. I have no regrets of this journey. I would like to continue this journey till I leave this universe.
I wish you live 100 of years.
Yes, I would love to live it, yes.
Yes, sir. So sir, my next question is like, when we compare of your time's OTs and of our time OTs, what changes have you seen and were it necessary?
Yeah, you remember that when I started in 1966 and today 2025, so nearly 60 years science and technology has advanced, and medical science has advanced too much, too good for the human race. Medical treatment, medical diagnosis and surgery, operation theatres have changed dramatically. The aim is to have good results of our treatment, of our surgeries. So obviously when it started it was a primitive stage, but now all operation theatres are air conditioned. Advanced operation theatres have a lot of filters so that no bacteria or viruses can enter, so infection rate goes down. Similarly, all OTs have now so much of monitoring devices. So we monitor patient during surgery, before surgery and after surgery to make the surgery safe. Our anesthetists, our technicians, our nurses and monitoring persons are all advanced. So it has become bigger and bigger operation theatres which can accommodate large number of equipments, both for safety of the patient as well as to make the results better. So obviously, as the necessary was thought about, it has been added to it. I remember when we started cardiac cath in 1975 at Sion Hospital, our anesthetist, head of the department with two assistant used to remain present when we used to do cardiac cath.
Okay.
But now our anesthesia is so advanced, so they don't need head of the department.
Okay.
Even the youngest anesthetist can take care of our
Okay.
requirements.
So was there any kind of fear when HOD used to be present there, head of department?
No. On the contrary,
Okay.
see, this is the difference in our medical field.
Okay.
Medical field in which we are learning throughout our life. Even today, at this age of 77 years, I learn daily. You can see so many books
Yes.
here. We have to read them. But the books are also our guides. Similarly, head of the department, our senior doctors, even our juniors, they teach us. Our technicians sometimes teach us because they have tremendous gained experience
Yes.
throughout the field. So there is no question of fear. On the contrary, that gives us confidence that we are going to do the right thing.
Okay, sir. Sir, my next question is to you. Please share your first experience of surgery and how nervous were you? And as a surgeon, what was going through your mind?
See, we cardiologists now do surgery in the form of angioplasty.
Okay.
We do opening of our vessels, coronary vessels. Similarly, we sometimes do replacing aortic valve, replacing mitral valve, and so. These are all surgeries being done now by cardiologists in our cardiac cath. So hence our cardiac cath department is almost like a operation theatres.
Okay.
There also we have a anesthetists, we have a technicians, we have a trained nurses, and so on. And is remember, we are never alone
Okay.
in our with the patients. We are not alone. There are so many people helping us, and so it is a teamwork. So we are not nervous. We are anxious to see what happens next.
Okay.
At the same time, see, all our operations, all our angioplasties, everything, we plan out much in advance.
Okay.
We have enough CT scan, MRI, other investigations, so we know exactly what we are going to do it.
Okay.
So we are not nervous, but at the same time we are confident but aware. We are conscious all the time, and there are team of people who, in case somebody makes mistakes, other person is there to correct our mistakes immediately. So we are not nervous. On the contrary, we enjoy working and getting better and better results.
Okay, sir. That's great. Next question is to you. Today, as we see, many youths are facing the problem of sudden heart failure, or you can say cardiac arrest, especially when they are working out in gym or running in on the field. So, what's the reason behind it? And people are actually confused. Like even after staying fit and healthy for such a long time, they aren't able to survive. So, what's the reason?
Yeah, remember, fitness does not guarantee that your heart is also good.
Yeah.
So when you are doing gym work, you are doing for your muscles, your body entire, but that is not good enough for the heart. The heart is a very complex structure. The coronary arteries, which gives blood supply to the heart, is a tiny vessels which give blood supply to each and every cell of the heart. Remember that these vessels are so sensitive to so many things. What you eat is very important.
Okay.
What you think is very important. When you are under stress, see, when you do over exercise, that releases certain hormones which may give you happiness but may be also harmful to your arteries. So it is not only the muscle fitness or body fitness that is important. One has to think about heart differently.
Okay.
See, coronary arteries are very small specialized vessels, and each artery has capacity to dilate and constrict, and it also have capacity to regenerate.
Okay.
The smaller new vessels also develop. So heart attack is increasing in the recent years because of so many factors. One is we are not very sure about what is going to happen to us next moment. So we are worried about it all the time. That worry itself is a greatest risk factor. Second thing, even if person is fit, they are smoking. They are taking excessive tobaccos, excessive tea, excessive coffee, they work overnight, and some people have working timings are different, so it affects the entire overall health. Coronary artery disease has a atherosclerosis, it becomes narrow. The cholesterol is deposited there. So if fat is more in the blood, even if you are fit, but more cholesterol in the body is harmful. So remember, there are so many factors, and person has to take enough rest also. It is not only exercise, enough sleep, a good diet, healthy diet. This is all important.
Sir, I would like to ask a joint question to it. Recently when many of the gym rats, youths, especially who does gym, they take certain kind of proteins powder. So does that do any effect on the heart?
Yeah, that is what I honestly believe, that gym is good to some extent, but gym is not necessary. Number two, the protein diet is not at all necessary according to me, unless it is advised by your doctor. Like those who have disease in which protein is not absorbed, at that time they give different types of diet. But otherwise healthy people can get good amount of protein from the routine our diet, and doing excessive exercise, breaking muscles, and then the gym people gives a special diet. According to me, honestly, it is not required. Actually, too much of gym is also not required. Whatever is, just do routine activity, that is good enough.
So, sir, my next question is to you, this is a technological era, and coming to an technology, AI and robotics are entering healthcare system, whether it's education or practices. You think these are amazing tools, or you still believe real magic exists only in doctors' human judgment?
See, doctors' human judgment is supreme, there is no question about it. But we are already using AI in our medical practice now. Similarly, robotics are also being used in various fields of medical, like robotic knee surgery is quite popular. Robotic orthopedic surgery is quite popular. Similarly, robotic coronary artery bypass surgery has also been tried, even in Bombay, in Ahmedabad, and so many parts of the country. Robotic coronary bypass surgery is also, angioplasties are also being used. It gives more precision. So chances of complications are minimized. Only very recently, it was in the news that a doctor sitting in Hyderabad operated a child in a distant place. But remember, the distant place, it's not a total village. There is also a hospital. There is also assistant doctor who was putting all the robotic instrument. Similarly, Dr. Tejas Patel in Ahmedabad did coronary bypass surgery by sitting at Pramukh Swami's place, and then surgery was done at other hospital. But both persons were highly qualified. So even if this would have failed, other would have taken care of it. So it is advancing. We are making best use of it. AI is very useful in diagnosis of ECGs, CT reports, and MRI, where this AI is using thousands of reports and then giving reports. So I think very useful. We are taking good use of it, but at the same time, human touch has to be there. Final diagnosis is done by humans. But they take help of AI and robotics.
And sir, as you say, your currently age is 77 years young. I would not say old, but young. So what's the secret of your fitness? And even after gaining so much of education, you were still excited to learn computer skills in our college, that is Somaya College. So what's the secret of your motivation to do it?
Yeah, one thing is there, if we stop learning, we start dying. So we must learn every day. I learned from you, easy. Like you are taking podcast. It's new for us. But at the same time, we would love to learn and explore it, which is going to help humanity as such. So learning has to be there. Learning has to be continuously and from all the sources. So we have to learn even computer, robotics, AI, and even journalism and other things. Every field which is useful to us, we must explore it and we must learn, which
Okay.
keeps us fit and happy.
Yes.
See, fitness is based because of mind.
Yes.
If you are happy, if you are learning daily, then you will be always evolving daily. Because remember, our cell is capacity to regenerate.
Okay.
Its capacity to die.
Yes.
So every day cells are dying and new cells are coming. So there is nothing fixed, everything is changing, and we must make best use of the new technologies.
Okay. I hope you keep learning the new things again and again.
Yes, I will continue because see, you said I hope you live 100 years.
Yes, sir.
But my target is
200.
125 years.
Yeah.
Why? Because Krishna lived 125
Yes,
years.
sir. Yes.
So if Krishna can live 125 years, some 5,000 years ago,
Yes.
that is simply because he was Sthita Prajna
Yes.
and he was detached.
Yes.
But in the last days of his life, he was alone.
Yes.
So one has to learn how to remain alone,
Yes.
how to remain happy even with the entire disturbances. Even in the war situation,
Yes.
he was calm and cool. So we have to learn a lot from teachings of Krishna. And if
Okay.
we can learn, I think we can live also like what he has lived.
Okay, sir. Sir, based on your experience, if today's doctors had to experience any challenge from your era, which would you choose for them? Like there are many, like wards without AC, air conditioners, shortages of medicines, or only handwritten notes. So what's your?
Yeah, see, all the three questions are very good because we used to write handwritten prescription in the earlier days. But let me tell you honestly, in emergencies, we sometimes don't have time even to write anything. We have to just order, sister bring this, sister
Okay.
give this. We don't waste our time in writing notes.
Yes.
We just deliver to the patient. The patient is not breathing. At that time we don't go on writing, patient is not breathing. We just see and we start treating them. That is one thing. Handwritten or computer written is a different thing. And more, see, today when I started my practice, in Sion Hospital ICU, we had a 8-bedded ICU and there were open windows were there. There were no AC.
Okay.
But those days there was only Hewlett-Packard monitor and defibrillator and a pacemaker. Only three things were there, and of course drugs and medicine. Medicines were kept in a fridge, and that is a different story. But otherwise AC was not required for the patient or for the doctors. But today there are so many equipments in our new ICCUs, in operation theaters. These instruments will gather the dust and they will become dysfunctional very soon. That's why AC is necessary.
Okay.
Otherwise AC is not necessary. So without AC also one can treat the patient.
Okay.
Doctor doesn't need AC. They can work without AC, but because of instruments and say monitors and other things, that's why AC is required. And third question one is
Shortages of medicine.
yeah. See, when we started our practice, see,
Yes.
I remember during MD period,
Yes.
when we were treating heart attack patient between 70 to 75, there was no cardiac monitor in the college where I studied. There was only one ECG machine. So only few limited patients we will take ECG. There was no cardiac monitoring, but still we are treating heart attack patient in our time. There were no medicine, only pethidine and morphine was for the pain,
Okay.
and oxygen and the rest. That was the treatment of heart attack in 1970.
Okay.
So that is a 55 years ago.
Okay.
Afterwards, never newer and newer drugs were added. That, of course, in those days, people used to die 30 to 40%. When I started my practice in 1981, mortality rate was about 22 out of 100. 22 patients of heart attack will die.
Okay.
But today, heart attack mortality is 4 to 5%.
Okay.
Because earlier you reach to the hospital, earlier they diagnose, and immediately they give emergency treatment, patient survives.
Yes.
And they live longer also because of newer drugs, newer therapy, newer machines and other thing has improved mortality and results.
Okay. So my next question is to you. Like speaking about future, how do you see healthcare education, particularly in India? Like what it lacks according to you, and what can be added? And any advice of you to help policymakers?
I would say first the title was medicine then, now and future.
Yes.
I can say then means in the past when I started it was good.
Yes.
Now it better
Yes.
and future will be the best
Best.
because it is evolving.
Hmm.
Even policy is evolving
Yes.
and we are gaining experiences.
Hmm.
So whatever new policies, see there are brilliant mind in India also. So our Indian policy is much better than even policy done abroad.
Okay.
So I think we are in the right path. Our policy makers are doing good thing. See when we started, see I was a Gujarati fellow. Our education was in Gujarati.
Okay.
When we entered medical college, straightway all the textbook came in English.
Yes.
So there was a shock to all of us. And the first year, many students used to die, or rather, some of them
Okay.
used to do suicide.
Okay.
Some used to leave the job, means study, and those who survived first MBBS, then they can become a good doctor, because that was the thing.
Okay.
But now in our India, there are about 13 to 14 languages, textbooks of medicines are available.
Yes.
So students are learning. There is no much barrier of languages.
Okay.
Similarly, our training is also better because more and more good doctors are there now to teach.
Okay. So, like as you gain more of a knowledge from abroad also, so what's the difference you find between Indian medical system and foreign's?
See, our Indian medical system was originally Ayurvedic.
Yes.
We were good in it.
Yes.
Allopathy was started abroad,
Okay.
and their teaching methods were good. There, first of all, because there were a lot of good resources, and most of the research were being done abroad, in America, in Europe, and Germany, and like that. So obviously, that teaching was good to begin with. I went abroad 3 times with the patients, and there every time I spent more than 1 month there and tried to learn what they are doing. But I realized they are good, but there are less number of patients.
Okay.
While here, we have large number of patients.
Yes.
We cannot follow everything what they are doing there.
Yes. Correct.
They record each and everything,
Yes.
and then they do research on that. Here we cannot have a recording of all the patients.
Yes.
Of course, now in South India, there's many colleges, they are recording each and everything, and they are having so much original work is also being done.
Okay.
But all these years, original work was being done abroad.
Okay.
But now China is also advancing very fast.
Yes.
Similarly, India is also advancing very fast. The CT scan machines, MRI, and all the machines which are there abroad are now there in India. So we have large number of experiences. In fact, some of the new instruments, they first try now in India because there are large number of patients.
Yes.
So now we are catching up, and in some places we are better than in America or Europe.
Okay. So now this is one critical question. Tell me your views about private medical colleges and their massive fee structure, which goes above 1 crore rupees. How a middle class student tackle this affordability problem? Because even today, number of medical colleges lacks in India.
Yes, I agree with you. When I started, there were 100 medical colleges in our entire India.
Okay.
Today, there are more than 600 medical
Yes.
colleges. Government is planning to have one medical college per each district.
Oh.
They are also planning to have medical college, nursing school,
Okay.
engineering college,
Okay.
agricultural college by every district.
Oh.
That is their plan. in the beginning there was hurdle of medical council. They will do inspections and then they will say this is lacking, that is lacking. They never used to give permission. But government changed all the rules and regulations, and then now it is easy to have medical colleges. So now more than 600 medical colleges are there. But everything government cannot do it. And we have so many industrialists, businessmen, and even our society itself generates fund and develops private medical colleges.
Okay.
So when government has to spend so much of money, but now that is being done by privately. Hence, they have to recover the money.
Okay.
So they divide it against the students, and that's why price is going up. That's why you must realize medical, but that is not true only for medical college.
Okay.
Even engineering college,
Yes.
it's very expensive,
Yes.
private.
Yes.
So it is true for everything. Even your Somaya college itself is a private. Somaya Medical College is a private,
Yes. Private.
and they cannot go in losses.
Yes.
The government is taking taxes and that is subsidizing the government colleges. So prices are, of course, economy will decide what should be the fees. Even they tell us, even one of my friend was telling, okay, we people, doctors in our nursing homes, we don't make much money.
Okay.
By and large, we just can. That's why you will never see a doctor which is having crores of rupees like industrialists, Ambani, Adanis and like this.
Okay.
But they can just manage, but they have to do so many free things also. So pricing depends on the economy.
Okay.
What is the expenditure, and accordingly they have to decide. Of course, middle class people cannot, but now that's why government is giving so much of scholarship.
Yes.
Let me tell you honestly, I have not spent a single paisa till I passed my MD medicine.
Oh.
Because I was from 5th standard onwards, where in 5th standard my fee in my school was 5 rupees per month. But that also my father could not afford.
Yes.
So he told, okay, now from next year we'll send you to other school where the fees is 4 annas. My principal came to my home.
Okay.
They have seen our situation. They took lunch with us, and then he told my father, okay, now this boy is very good. He will continue in my school, and I will not charge even 4 annas, 0 paisas. So that even then my father said no. My other younger brother, my sister is also studying there.
Yes.
So okay, all three I will make totally free.
Okay.
So I was made free education from 5th standard to, then I went to other school. There also the same principal told them that this boy don't charge. They did not charge. Thereafter I had a national scholarship. In medical college also I had a scholarship.
Yes.
And I spent no money basically during my education at all. But that is also possible even today. Many students get scholarships and they.
Okay. So, any myths which you would like to clarify, like bust or you can bust for common public regarding heart diseases?
Okay. First of all, heart disease is increasing. There is no question about it. At the same time, treatment also is advanced. So what I advise to my all patients that any chest pain, you should treat it as a heart disease unless proved otherwise. So they must immediately go to the nearest hospital, get an ECG done. And most of the time ECG can pick up, or a good doctor can pick up even with normal ECG a heart disease like heart attack. So if they consider every pain is acidity only, they don't go to the doctor, then they just die at home.
Yes.
It's a wrong thing. But once they get experience, this is the pain. Like classical heart attack pain is in the center of the chest. It's a heaviness. It's occurring for the first time in their life. It may go to the left arm, or to the neck, up to the jaw, or up to the umbilicus, and also on the back side. The pain will have a character of a heaviness, pressing type. It may be associated with nausea or vomiting or perspiration or breathlessness. So this is the classical thing. So if any of such symptoms are there, they should not neglect it, because acidity pain, patient will not die. Any gallstone pain, patient will not die. Any lungs problem pain, patient will not die. But if it is due to a heart attack, patient can die instantly.
Yes.
So one has to diagnose properly, should go approach the doctor immediately, and today immediately ECG and blood test can reveal if heart disease are there or not. But at the same time, some of the patients, they come again and again and again. Then we do stress test, we do echo, even sometimes we do CT coronary angio and confirm it is there or it is not there. But one should not neglect coronary artery disease or the heart attack.
Okay. So as a closing question, it's my final question, I would like to ask you, any special mantra which you would like to give to today's generation, especially one habit to adopt and one to quit, which immediately?
Oh, this is very last question, but very difficult question. So what I say to whether doctor or non-doctor,
Yes.
you should be always honest. You should not tell lies.
Okay.
And you should be sincere about whatever you do. When you are studying, you are being a doctor or practicing, you should be sincere, honest to yourself and to your patient.
Okay.
You should not do anything just to get money. That is the important thing. Because the money is going to come to the people who deserve it, isn't it?
Yes.
So, if you are doing anything which is not according to your conscience, don't do it.
Okay.
Don't tell lies. Don't cheat yourself and to anybody else. You should be honest all the time. It's not that I am honest today to you and I am deceiving somebody else. No. It should be a continuous mantra for you that I have to be honest to myself. You should see, after all, you are not going to lose anything. See, God, whether He is there or not, I don't know, but nature, you are there, you become a doctor, you reach this stage, that itself is good.
Yes.
Because many people do not survive even the childhood. You have become a doctor. So that's a good thing. So always be thankful to the nature and do your job honestly and sincerely.
Okay. So, okay, thanks for joining, Rohit sir. It's being very informative talking with you, and hopefully we'll see you in next episode on the new MACJ Mic'd Up. So, thank you, sir.
Thank you very much. I hope I have satisfied your question.
Yes, sir. Most
And based on my own experience,
Yes.
of course, some of these things may not be scientific, but it's based on my own experience.
Yes, sir. And that's what matters. Okay.
Thank you,
So,
sir.
thank you.